Hello, and welcome to Public Health Matters, a monthly program dedicated to discussing public health issues in our community. This program is sponsored by the Middle-Brook Regional Health Commission, which serves the towns of Bound Brook, Greenbrook, Middlesex, South Bound Brook, Warren, and Watchung. My name is Colleen McKay Wharton, and I'm the health educator for the Commission and the host of this program. Our goal for Public Health Matters is to give you a program that will provide useful information to help you better understand important public health issues, and in particular, what you can do to help reduce any risks that may be associated with them. January is National Cervical Health Awareness Month. You know, the American Cancer Society has predicted that there will be about 11,000 new cases of invasive cervical cancer in the United States in 2008. And close to 4,000 can actually die from this disease this year as well. But the good news is that cervical cancer, if it's found early and treated early, can often be cured. And now there's even a vaccine that may also work to prevent it. Our guests today are Dr. Randi Protter, who is the Medical Director of Women's Health and Counseling Center in Somerville, and May Balin, who is the Director of Health Administration and Education, also at Women's Health and Counseling. So thank you both so much for joining us today. We appreciate your taking your time.
Thank you.
Dr. Protter, why don't we start with you? Maybe we can start with some basics first. Can you tell us a little bit about what the cervix is and what its role is in a woman's body?
Absolutely. The cervix is actually the lowest part of the uterus, and it connects the uterus to the vagina.
Okay.
It acts actually like a passageway, so that the uterus or the womb, when it has a baby inside and the baby needs to come out, the cervix opens or dilates, allowing the baby to come out and pass through to the outside world.
Okay.
I have a little model here.
Okay.
And you can see if this is sort of a cross-section of a woman, this would be her uterus here. At the very, very end is the cervix. So it's really connected.
Okay.
And then out this way is the vagina.
Okay. Great, thank you. You know, now when we hear the term cervical cancer, and as I mentioned, it's Cervical Health Awareness Month, and we realize that there are many issues that can arise addressing the involving the cervix. But specifically, what is cervical cancer about? What's happening when we use that term?
Well, the good news is that we're using that term less and less. What we hear more and more of is cervical precancer.
Okay.
And that's because cervical cancer represents a technology success story. We know the germ that causes cervical cancer. We understand the transition that cells have to go through from normal to progressively more abnormal to ultimately cancer.
Okay.
We have tremendous ways for screening through pap smears. I've brought some examples of that today.
Okay.
And we also have simple and effective treatments that treat the precancerous conditions, making true cancer so highly preventable.
Excellent. You know, we don't hear that often about cancers.
Absolutely.
And there's very few that we can really say that about. Now, it's interesting, you used a term that we don't often hear, and maybe we'll address this. You said that we know the germ.
That's right.
That causes cancer. And talk a little bit about that. What sort of germ is that? And
the germ that causes cervical cancer is called the human papilloma virus.
Okay.
And the human papilloma virus is actually a family of viruses.
Okay.
Some of them cause warts on the feet or plantar warts.
Right.
Others cause warts on the skin, common warts. Oral warts, we see these warts in many different places. There are certain members of that family that invade the cervix, and sometimes, not very often, but sometimes the woman's cervix becomes progressively abnormal to the point at which it becomes cancer.
Okay, interesting. And this is quite the breakthrough to really understand that that virus has this long-term outcome, potentially.
That's right.
Potentially.
Absolutely. And what's interesting about the virus is that it is the most common sexually transmitted disease, not only in this country, but around the world. And what we see is we can see by 50% of Americans will have this, those that are sexually active.
Okay.
In this country alone, there are 20 million people that have the virus, and 6.2 million new cases occur every year. But the piece that's important to remember is despite all of these cases, only a very, very tiny amount of women will go on to develop cervical cancer.
Okay.
So the virus is necessary in almost all cases for the development of cervical cancer, but having the virus is by no means a guarantee that you will get cervical cancer.
Yeah, that's such an important distinction, and a very, I'm glad you've highlighted that. You know, speaking on things like risk factors and how that may be a potential risk factor for cervical cancer, one of the things we talk about a lot on the program are things people can do to reduce their risks and what's preventable and what's not preventable. Can we talk a little bit about some of the other risk factors, if there are, that are not preventable?
Absolutely. What I'd like to do first is step back a little bit.
Sure.
When I discuss risk factors, I always talk about what it means to have a risk factor.
Okay.
And in a sense, a risk factor is anything that will increase your likelihood of getting a disease, but it's not a guarantee that you're going to get the disease. So we just sort of need to frame it out in that context.
Perfect, thank you.
There are two kinds of risk factors. One kind is modifiable, as you mentioned, things that we can change. And then there's a second kind, which is non-modifiable, things that we have absolutely no control over. So if we start with the things that are non-modifiable, things that we can't change, a perfect example would be your family history. So if you have a mother or a sister that has had cervical cancer, your risk is probably 2 to 3 times greater than the average person without that family history. Another example would be if you have some kind of an immune suppression. So people that have HIV, people that are currently going through chemotherapy, people that have suppression for other reasons, that are on chronic steroids, they also would have an increased likelihood of having cervical cancer.
Now, is there also, and I recall reading some information about something that your mom may have taken?
Absolutely. Diethylstilbestrol, or DES, the daughters of mothers who took this drug, and it really hasn't been used since 1971. So we're talking about before 1971, when moms took this medicine to prevent miscarriages. Their daughters are at an increased risk of having cervical cancer as well.
Okay. So now, if those are the ones that we can't control and the things we can't prevent, but there are certainly many that we can and have an impact on, and what might those be?
Right. Well, things that we could do for one would be diet. A diet rich, I see you have some beautiful fruits here. A diet rich in fruits and vegetables is thought to prevent cervical cancer. Smoking, right? Smoking, so many diseases are affected by smoking. Cancers, heart disease, lung disease, pretty much every kind of disease.
One more reason, folks.
That's right. Well, smoking will increase a woman's risk of cervical cancer by 2- or 3-fold as well. So one thing you could do is stop smoking to improve your chances of not getting cervical cancer.
Absolutely. Other things that are preventable, other risk factors that we can...
There are birth control pills. There are some studies that show that birth control pills slightly increase the risk of cervical cancer. Of course, the birth control pills can also reduce risks of other kinds of cancers. So we need to sort of take it in the context, and I encourage women to speak with their personal physician or clinician to discuss those options. But that's another item, too, that you can consider. We see low socioeconomic status is also associated. That's one of those non-modifiable risk factors, but I think it bears mentioning.
Right. And now, is the thought there that women who may not have access to early screenings, or is there some